Season's greetings to all of you in the UTMB family. This is certainly a time of year for many celebrations, and in today's town hall at UTMB and Levin Auditorium on the main campus in Galveston, we spent a little bit of time reflecting on how fortunate we are to have both patients and employees who are outstanding. We did a special shout out today to one of our special individuals and employees at UTMB's Rehabilitation Center for the absolutely marvelous work that they've been able to do over a number of years for families who have graduates from the UTMB's Neonatal Intensive Care Unit. In particular, we took a moment to recognize Terry Tullis, who is one of our occupational therapy rehab specialists for premature children. And today's surprise in that encounter was reuniting Terry with the Acosta family. Sonia, her husband Francisco, and Alejandro, their 17-year-old son who was cared for in the Neonatal Intensive Care Unit and still comes to each of the yearly reunions. So in a surprise reunion today, we had a special moment recognizing also the neonatal nursery staff, Dr. Joan Richardson, who founded that nursery many years ago, and all of her staff, including Dr. Fonseca and others. It was a really special moment that brought an individual with unique rehabilitation skills together with her first patient, who was a very tiny premature baby. Alejandro is anything but tiny now. He is a full-grown young man of 17 who is facing no major challenges in his life other than finishing his last year of high school. With that kind of start, we had an opportunity to also go back and reflect on many of the other accomplishments of 2019 here at UTMB. We also recognized the team of people, Tim Harden and the nursing staff and hospital administrator Christina Lambert, in their incredible and remarkable journey to Joint Commission accreditation for the League City and the Clear Lake campuses. Both of those hospitals are newly accredited with flying colors from the Joint Commission, and we're real happy about the new services that they will be offering in the future. We also had an opportunity to shout out Dr. Cynthia Giudice, Rex McCollum, and their team and nursing staff in the direction of Ann O'Connell for the remarkable job they did in receiving NCQA accreditation for all of the clinics in the area of medical home recognition. This is a remarkable task that has taken over 6 years to win that full accreditation. A multi-step process with many challenges. Dr. Giudice led an extraordinary group of people in all of the outpatient clinics and all of the UTMB clinics to get that accomplished. We also looked at many of the other things that have happened this year, from the opening of that Clear Lake Hospital and the expansion of services there that have occurred almost monthly with additional beds being opened, to the full-scale development of the MD Anderson Cancer Services at the League City campus. That included, by the way, a move of obstetrical and women's health services from the League City campus over to the Clear Lake campus, and many more logistical changes that occurred on both of those campuses to get them ready for Joint Commission and for their future roles. The League City role is going to be one of more operations on site at the League City campus by MD Anderson and UTMB surgeons, by the expansion of hospital care for cancer patients who've undergone surgery, and also the development and implementation of what's called a survivorship program. That is, what happens to the patient who has gone through an episode of cancer, completed chemotherapy, radiation therapy, or other interventions, and is now pronounced to be well? what sort of challenges do they face? Rehabilitation after chemotherapy, cancer and all, is sometimes a very big deal for the average patient. And to be able to obtain those services in the Clear Lake and Galveston County area is now a reality, and one that we will bring further to fruition in the next several months. In addition to that relationship, on the other campus, we will be opening in the Clear Lake Hospital a marvelous new pediatric hospital in collaboration with Memorial Hermann Pediatrics. In doing that, we will have an entire floor of the hospital devoted to pediatric care, including 10 or more ICU beds. So no more will people have to go up into the Texas Medical Center or down to Galveston Island to get the high quality pediatric care that they deserve. They'll be able to get it in their own Clear Lake Bay Area community. And we're very, very happy about that, because coming with those additions will also be a designated pediatric intensive care unit and a pediatric emergency room. Both of those will be very welcomed and new additions, along with multiple pediatric specialists, including behavioral health, ENT, and cardiology, all sorts of other programs that most families expect from a full-service, multi-categorical health system. These will all be available in the Clear Lake area in the next several months. It's a really exciting time to live in this particular space for families and folks in general who need healthcare services. At UTMB, we have a strategic plan that we are following, that we update regularly, almost monthly, frankly, in keeping our own house in order. Our Jeannie Seely Hospital is doing well in serving the needs of the Galveston Island community, and in fact has experienced a growth in the number of patients it sees over the last part of this year. The first part of fiscal year 2020 for us has been off to a good start, with us achieving our budget expectations in all of our hospital settings and managing our costs effectively in the administrative areas, in the academic research and support services enterprises on Galveston Island. We are happy about the continued growth that the Health Education Center has brought to the island, with the new HEC being a literal magnet for students. As a matter of fact, this morning we welcomed hundreds of students to breakfast in the HEC, since this is kicking off a week of exams that occurs for the next several weeks of exams as schools of health professions, nursing, medicine, and others offer their finals for the fall semester. There'll be no big break for most of the schools, with many people in their third and fourth year of medical school training moving on to yet another rotation in their quest for their MD degree, or taking a special research elective or a personal development elective during this next 4 weeks of time. Lots of activity continues on our Galveston campus, even though many in the rest of the world will be taking a break from regular workday activities. Not so of a healthcare enterprise that is always seeing patients 24 hours a day, 7 days a week. And speaking of 24 hours a day, our faculty and staff will continue to work most of the time through the holidays, either in the research area or patient care areas, in doing their jobs of continuing to advance the growth of our scientific knowledge or our care for patients. In addition to the League City and Clear Lake areas this year, we've also had continued and solid growth in our Angleton-Danbury campus. We celebrate our 5th year of operations there with good relationships and solid performance among our 20 new faculty members who take care of patients in that setting. We also have an ambitious recruitment agenda throughout our sites of Galveston, Angleton, Danbury, League City, and Clear Lake, with a goal of bringing in some 100 new faculty members over the next 12 months. We'll also be looking at expanding the number of residents in our multiple programs and creating new spaces for the education of medical students. With the rapid growth of medicine in Texas in the form of new medical schools, that creates a challenge for us to find clinical spaces for our students to engage in meaningful learning activity with qualified oversight from physicians and nursing mentors. For that reason, we are taking an ambitious stance at growing our own places in our own health system. And for any of you who are listening, who are alumni that would like to have some of our students in your clinical practice, please give us a call. We also have an AHEC Scholars Program that is helping grow that development by deferring some of the cost for our students. We looked forward to an ambitious year in 2020 for UTMB's continued growth in these and other areas. Stay tuned for the developments next year. We'll be back talking with you early in 2020. Happy New Year.
UTMB Health, working together to work wonders.